Welcome, ladies and gentlemen, to Talk Junkies, where today is going to be a very interesting podcast. We got Johnny and Jesse back in the house. Again, last week we had Dan on. Johnny and Jesse, we just had conflicting days. A wedding showed up, blah, blah, blah. We're back in the groove, baby. Tonight is going to be very interesting to all our listeners out there for the first time in Talk Junkies history, which is a little over 2 years and a few months old. We're bringing a doctor onto the show.
We had Dr. Neha Kapoor before.
Very true.
Yes.
Well, she's a psychotherapist.
You're right.
But, sorry, an ER doctor. Probably a little bit of everything, honestly. Dr. Ure, thanks for joining the show, and how are you doing today?
Fantastic. We've had a wonderful day. Went horseback riding a little bit earlier. We took a young man that was in his probably early 20s that was raised out in Wyoming up to about the age of 8, but he had never really ridden a horse. And I kind of thought that he had horseback riding, but when he got on it, it was obvious the horse walked right into the barn with him, and I could see from the beginning that he needed a little bit of help. So, but it was a fun afternoon.
Good, man. Well, tell us about yourself. Tell all of our viewers out there, just kind of a little bit about your journey, man.
I am a family practice emergency room doctor. I've been doing it for 38 years. I went to the University of Health Sciences up at Kansas City, Missouri, on Independence Boulevard. They used to be known as the Kansas City College of Osteopathic Medicine, but they changed their name to Kansas City University of Medicine and Bioscience. And if you get an opportunity to go over there, just off of Paseo, it's quite an impressive medical school, and we're really proud of the number of students that they're putting out there. We can be happy that we've got such a high quality school with so many wonderful buildings and instructors and like that. We didn't have that back when I went to school. We went to school for the first and second year in what was called the bunker, because it was just a cement block building. But they've come a long way from that. Graduated out of there in 1982, did rotating internship covering all the various specialties. I live right now on Truman Lake, which is south of Kansas City, south and east, about 20 miles from Clinton, Missouri. And so I'm living in the home. This fireplace behind me here is where my folks lived for about 20 years, and I've lived here for nearly 20 years. My folks died a number of years back, but there's a lot of happy memories here. I did a lot of emergency room work around here. I've done Butler and Harrisonville and Appleton City. Trying to think, we did Sedalia, Whiteman Air Force Base, quite a number of emergency rooms. And then I had my own office up in Olathe, Kansas for 9 years. And had, unfortunately, after that 9 years, it was a very sad situation, not making enough money, having to shut the clinic down because I was spending all of my time, weekends and nights in the emergency rooms, trying to make enough money to keep the clinic running. And so it was like having to go through a divorce, something that I had built from scratch, out there, actually marking off what I wanted for exam rooms and x-ray equipment, what have you, before the building was ever built, and had windows put in custom. And it was a very nice clinic. Problem of it is, couldn't generate enough money to just stay there on a routine basis. One time I tried the deal, instead of call and ask a nurse, why call and ask a nurse, call and ask a doctor? And I thought, well, I'll tell you what, I'll keep the clinic open 7 days a week. That way people can come on Saturday and Sunday. I did that for a number of months. The only thing that ended up doing was the people that would have come to see me during the week didn't do that, and they came on the weekends. So my numbers of patients didn't go up. It just meant I saw the same people for 7 days. Following that, I did a lot of emergency room work. Primarily worked up at Kirksville. I worked at Brookfield for about 12 years up in northern Missouri. The most recent facility I worked in 2016 was up at Putnam County in Unionville, Missouri.
Now,
And that was
real
a good
quick,
experience.
I'm sorry to interrupt you. I just want to
Excuse me.
scroll back real quick because I thought of
Okay.
something. Do you ever think it's an issue
That's all right.
in having a clinic of your own in a more rural area like that, to where there are certain individuals that are so hesitant to go to the hospital because they're like farmers and white collar individuals, and especially males? You know how males are. Whenever we get sick, we'll go, no, we're just gonna fight through this. We'll be good here, and then they don't go to places like that too quick. Do you think it has anything to do with that at all?
Well, that's a good question. And, one of the reasons I set that clinic up in Olathe is my wife divorced me between my third and my fourth year of medical school. And that was pretty traumatic. It was very difficult to study and have my mind on my books and taking tests and so on when that had taken place. And so I built a house a couple of miles away from where they live, thinking the kids could ride their bikes over, and put the clinic there to try to be around my children. But that didn't really work out the way I wanted it to. When we come back and answer your question, I want to tell you of something I tried that was maybe a little bit too little too late. I dreamed up a thing that was called the Family Practice Plan, which should have been great. The reason I did it was because, just like you're saying, people didn't have insurance, and they had the pediatric, the little 3 and 4 years old, and they held off bringing them to me until they were very sick, and it was difficult to get the kids better. So what I came up with was a prepaid medical. I think I charged like $25 a month for a family of 4, and then I did like $5 a month more for each kid, like up to like 6 kids. And so it was like for $65 a month, they could come to me, get any of the in-house labs done, any x-ray and such as that done. I can remember, interestingly, one lady had Prime Health, and she ended up signing up for that program. And she told her husband she didn't like going to Prime Health, but she would have to. And he said, well, it's really worth the money to Dr. Ure, $65 a month for keep your mouth shut and go see him, So I didn't expect it to be that way. And now they call this, what I dreamed up, concierge medicine. And out in California, people pay $2,000 or $3,000 a month to a doctor, and then all of their office visits are covered. So it's not insurance, it's prepaid medical. And I tried doing that a lot down here where I am, but living in St. Clair County, where I am here on Truman Lake, it's the poorest county in the state of Missouri, and people don't have money. I always felt like I was trying to figure out, how I could not get into somebody's pocketbook very much, because I never had a lot of money when I was growing up, and I always tried to be reasonable, and I know I way undercharge, for fees and things of that nature throughout my time. There's been tons of patients I've seen. I can give you a classic example of something I tried to show you how messed up the system is, because, we've got Medicare for the elderly, we've got Medicaid for the people that don't have insurance. So I thought, okay, let me sign up for Kansas Medicaid. They were going to give me $3 per person per month, whether I saw them or not. And I thought, well, if I had 1,000 people, including the families, maybe 2 or 3 kids or whatever, that would give me $3,000 a month. That would really help out. So I started seeing these folks. They had I think it was at the time, it was either $3 or $1 that they had to pay cash for when they were seen. What they would invariably do, they'd put a pack of cigarettes up on the counter, say they didn't have any cash, and then after they left my office, they would go right next door to the sandwich store, which I could see them in there buying their lunch and so on, but they didn't have that buck to give me. And so after about 6 months, I never had gotten any payment at all for any of the billings that I had done for patients I'd seen, nor had they ever paid me that $1 per person per month. And so I said, well, this is ridiculous. And because I was paying a staff to send in the insurance claims, and they kept mailing them back with yellow marks on them of things that weren't done right. So then I had a $10 an hour person that I was paying to have to redo it. So it was like, I would rather see them for free and not even, have that hassle. So that gives you an idea of the corruption. Another thing that really irritated me one time when I was up at Brookfield working in their clinic, they had a deal that was called a T-sheet. And that T-sheet is short for template. Well, let me back up just a little bit. Prior to that, the doctors would see a patient, they would take notes, jot some things down, and then at the conclusion of the patient interaction, they would do a complete dictation. It was called like a SOAP note, subjective, objective, assessment, and plan. And you would cover all those things, and then you would review the lab and this and that and the other, and that was a great way of doing it. Okay, so now the next thing they did in the scheme of things is they came up with these templates, and then they sold these to the hospital. So if somebody came in complaining of an earache, the nurse put an earache template on there. If they had problems with their eyes, so on and so forth. Okay, so on this particular day, I saw somebody in the clinic that had a problem with their ear. I think it was a young child, 10, 11, 12, something like that. And so I took care of it. The manager of the clinic came to me and said, hey, look, you didn't put anything on here about the lungs, about the heart, the abdomen, and like that. We need to mention all these things so it puts it to a higher level of care so we get paid more money. And I said, okay, fine, I'll do that. And I didn't think that that was appropriate, but that's the way it was. Now, you didn't ask me, but it comes to mind. I'm going to tell you what I think is the greatest travesty in my mind that's gone on in the medical profession, besides big business taking it over. It used to be that all CEOs of the hospital had to be doctors. No more. They're business people. They don't know anything about medicine.
So
they may have been nurses and such as that.
Doctor, before you get into that, that's you've given just a couple of snippets of how the industry is corrupt, and I think just for the listener's sake, I think right now what we're going to dive deep into is how big our medicine, just in general in the United States, how it's being corrupt and how it's corrupt or how it's been corrupted. And again, you just gave just a few brief descriptions, but Doctor, I'm sure you were just about to go into it, but what have you seen from like a national level? And I'm sure what you were just about to describe may have mentioned that, but that's what we're big on here.
I'll tell you that, but what I was getting ready to tell you about is the electronic medical records. Have you heard of those?
Mm-hmm.
Okay, electronic medical records. Now, to give you an idea of how the system should have worked, I was an aviation medical examiner. The Center for Air Traffic Control up in Olathe covers 5 states. And so I went out to Los Angeles when I was in my own office and became certified so I could get flight physicals to first, second, and third class pilots. And so when that with those physicals and like that, at first they were done on paper, and they were basically carboned, and you sent them down to Oklahoma City. Well, then they decided that they would go ahead and start doing it electronically. Well, they sent out to all of we doctors a disk to load into our computers so that every doctor in the whole United States that was a medical examiner for the government had the same software. And so it went down there, and it was a very good system. But when they did the electronic medical records, they let it be open to every vendor so you could have all different prices. Every clinic had a different kind of software. Every hospital had a different kind of software. None of them blended or talked to each other. So you still had to come back and fax things to them because they thought that they would be able to have ready access to it. And the big problem, if you walk into any emergency room in the United States this very minute, you're going to see the doctors, and you're going to see the nurses and the ancillary people all sitting there typing on computers. Nobody's paying any attention to the patients. We're giving patient care, and it's also dry labbing it. I don't know if you guys are familiar, but there's a terminology in the laboratory, WNL, that stands for within normal limits. Well, laughingly, in medical school, we call that we never looked. And so they'll go down through there checking off eyes, ears, nose, throat, heart, lungs, abdomen, extremities. Click, 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 click. And then when you get something sent to you, it's a great looking report, but it tells you virtually nothing, and most of it's bogus. So there you go.
So going to the ER is basically pointless. I mean, I went there, I think it was like 2 years ago, because I had filled something on my right side. And I went there, I waited for probably like an hour and a half, 2 hours. And I had insurance at the time. Then I go in there, they literally just hooked saline solution or whatever, an IV, and then they drew my blood, and that was it. They're like, your blood work came back fine, you're good, see you later. And then they charged me like $1,000.
Yeah, I agree wholeheartedly. And part of the problem, and here you asked for one that's a real big deal. Back in '92, Dr. Carol Wetzel was alive at that time, and I was working in the emergency room up here in Clinton, Missouri. And Dr. Lane was one of the doctors working there at the hospital. He worked there for like 17 years. And he paid me one of the highest compliments that any doctor ever did. He said, Dr. Ure, if I ever went into practice with anybody, you would be the only one I would go into practice with. And I thought that was really a tremendous compliment. But he ended up quitting there. And one of the reasons he quit is because the administration of Golden Valley Hospital let go 150 years of experienced nurses and just said, we're not going to use you anymore. And they hired directly out of school nurses with no experience whatsoever for a whole lot less money. And it was absolutely horrendous. And so that's what we're faced with. Very poor education. You know, I'm so disappointed. I even said to one of the people up at the college where I went to school, to the university, you know, I'd like to go up there and teach some emergency room, you know, maybe some classes of ER. I said, you know what? We haven't taught any classes in emergency medicine in 10 years. I said, what? Well, that is so crazy, because all the doctors, they want to specialize. You know, I can tell you that my patients are on my cell phone. My number of my cell phone is in their phones. I have their picture. When they need me, they call me. They have hold me 24/7, and that's the way I think doctors have been in the past, but that's not the way they are today.
I mean, but there has to have been some instances within your career to where there were some cases that were outside of your scope of practice, to where you had to refer them to a specialist. I'm just assuming things, but
okay, well, yeah, that's absolutely true. Let me tell you of a situation here. Dr. Anglin worked at Boone Hospital up in Columbia. Back in 2003, I can remember it very well. I was on duty at Brookfield and covering the emergency room, and a young man across the street from the hospital had an ultralight airplane. Well, I have my private pilot license, and I flew back and forth to the hospital most of the time when the weather was good.
What? On what? A Cessna? On a Cessna?
Well, yeah, that type of plane. I've had 3 planes. I had a Cherokee 140, which is low wing 4-passenger, and then I bought a Mooney Executive, which was a great plane, and now I've got what's called a PA-20, a little tail dragger, high wing. But the story is this: he wanted me to teach him how to fly. So I got in that ultralight. I took off from a farmer's field north of Brookfield. I didn't put any glasses on, and I felt like Mary Poppins. It was like flying around the top of the tree level, flying. I was sitting in like a lawn chair, and it was kind of fun, but it was a little scary. So we went over to the airport there, and I landed, and the kid met me there, and I made some mistakes with it. I was too eager. When I saw him put gasoline in the tank, I thought, you're not putting very much gas in there. You just put a couple gallons in. I thought, well, he knows what he's doing. So when we were flying, my eyes were blurring, and I was looking up at the tank, and it's one of these tanks that you can see through the gasoline, kind of see where the level is. The problem is they had filled it up so many times, there was a nice brown stain at the full level. And I kept seeing that, thinking I was okay, and I had him with me, and the thing starts sputtering. And in trying to get us into a good place, we were flying right into some power lines. I dove down underneath them, should have stayed low, but I went up to try to get some altitude. That was a bad idea. The thing stalled again, and we dropped like a rock out of the sky. I broke both ankles, my right wrist, several ribs, had a pneumothorax in my right lung. And so then they hauled me back in the back of a pickup truck, and I've got my head laying on a spare tire, not in the ambulance, and here I am, the ER doctor, telling the people that are picking us up out in the field what they need to be doing to not screw us up.
Man, that's one thing I've always thought about, like experienced doctors like yourself who actually get injured and then need hospital help. Like, you have to, like, do you...
You're right.
So that you kind of answered my question, because I was like, do you just sit back and let them do that? Or do you just kind of take over because you're like, I know what the fuck should be happening here, and come on, you're messing this up right now.
When I was back in the ER within probably 2 hours of the time that I went off duty, and I'm still trying to tell the nurses, I think, get an IV started on me, give me a little bit of Demerol, for my pain in my fractured ankle. And so, anyway, fortunately, the guy that was there, and I wished I knew his name, but he did a good job. I've got a little hole over here in the right side where they put in a tube a chest tube in order to inflate my lung. Because as I was coming back, in the back of that thing, I started breathing. It was like, and I could feel that I was not getting the air that I needed, and it kind of scared me, and rightly so, because I nearly killed myself. But anyhow, what I'm getting at is this. When Dr. Anglin treated me, he put a plate, 8 screws in my left ankle and 2 screws in my right ankle. But there's something called fracture blisters, and you usually don't see them in the emergency room. So if you ever have a fractured ankle or like that, you can develop what's called a bulla, that'll be a half an inch or so of fluid, and it gets kind of dark looking, and there's nothing absolutely wrong with it. So anyway, I was back to work within, a few weeks on crutches and casts on my legs and so on. And after I convalesced a bit, we had a young man, 16 or so years old. He came in with what's called a trimalleolar fracture. Now, if you look down at your ankle, you got a bump on the inside, you got a bump on the outside, and then you got the back of the ankle. So it was actually fractured each one of those. Ooh. And his foot was, if you took the pin, for example, and had the foot down here, his foot was like that, like a golf club. So basically I had to reduce that, which I did, brought that back under, and put him into a splint. That's ER work. And so then I sent him home. I called the orthopedic doctor, told him what I did, that he doesn't need to see you for a couple of weeks because with all that swelling, you can't do surgery or anything. And he said, by golly, I wish there were more doctors out there that knew how to take care of these type of things instead of sending everything by ambulance down to us to take care of. Well, the rest of the story is this. A Filipino doctor that was in there a few days later, they come back in with these fracture blisters. He apparently had never seen them. And he actually took a needle, aspirated them to make a culture, and placed them on antibiotics, which was totally inappropriate for the care. The administrator of the hospital said, what's going on? Why are these back? Why is he doing this and that and the other? So then I'm having to stand up for myself that they didn't listen to me and do what I told them. And what they're doing here, the whole thing, the ER visit, the treatment and everything was bogus, wrong, inappropriate, and I think you can see that. And so then the kid was treated properly, but I've got to justify what I did to somebody who really doesn't know anything about what I did. Does that make sense?
Mm-hmm.
I've got a good one for you. Try this one on, guys, okay? You'll find this on my website. Can I tell people what my website is?
Oh, yeah, of course.
Absolutely. Shout it out.
Okay. My website is 4 words: down to earth medicine.org. And the reason I made it down to earth is because on my website, there is one tab that you can look at that's called Earthing. We maybe not get into it tonight, but I want to talk to you guys another time about it because it is the most revolutionary healthcare discovery of modern times. Nobody knows anything about it. There's one physician, her website is Intuition Physician, Laura Conover, back on the East Coast. She knows about it. She's an MD. I've never talked with her, but she's doing a great job with it. So anyway, let me see, I got sidetracked a little bit from the website. What were we talking about right before that?
Yeah, you said you had one for us.
I'm trying to tell you. Yeah. Wait. I do. Well, yes. Also on my website, it talks about cholesterol. Now, you guys know that this cholesterol stuff is all a gigantic lie, right?
I love it.
You don't know that?
I have never heard this once in my life before. I have close friends that are I'm in my late 20s, and I have friends who have been diagnosed cholesterol medication right around my age.
Really?
But
that's crazy.
Yeah, no, I'm obviously not going to say any names,
don't say
but
the names.
It's unhealthy diet and drinking, which I have an unhealthy diet and I also drink. But they had cholesterol, high cholesterol levels, and high blood pressure. I'm pretty sure they come intertwined, right? High cholesterol equals high blood pressure, right?
Yes, but the high cholesterol is a big lie, okay? Because your body manufactures cholesterol. Your liver manufactures cholesterol. You don't have to eat any cholesterol at all. But cholesterol is very important for your body because cholesterol is the precursor of adrenocorticotropic hormones, ACTH, and it's also the backbone of the sex hormones, both estrogen and testosterone. And so cholesterol is extremely important.
So you want to fuck after a cheeseburger then, right? My bad. I'm sorry. I hope he warned you. I cuss on this podcast, man.
All right.
I got to crack some jokes somewhere. My bad. Continue.
I liked it. It made me laugh. Something not in your brain, and it's called a glial cell, Glial. And the glial cell has several jobs, of which a very important one is to manufacture cholesterol for the brain. So half of your brain by weight is made up of cholesterol. So when you take a statin drug that actually decreases the production of cholesterol, now they didn't have these when I went to medical school, but they taught us about cholesterol as a big bad boogeyman and so on. And the only thing they told us was to use niacin and red rice yeast and so on and so forth. My article on there, it says, like the wise guy said, forget about it. Don't even worry about your cholesterol unless it's something like a hypercholesterolemia, which is totally off the chart. You don't need to worry about it because the whole thing is based on a gigantic lie. Ansel Keys came up with a paper with his Mediterranean diet and so on, and he disregarded a lot of the countries that were in the study only to get his Mediterranean diet, and later they found out that the whole thing was a fraud. So we have right now 50 million Americans taking a cholesterol-lowering drug, and Lipitor is the most common one that's used. It is that medicine is written for more so than any medicine in the history of medicine by far. And these people are damaging themselves irreparably. They're destroying their muscles of their body, and they're going into senile dementia and Alzheimer's disease. That's why we have an epidemic that's going on. Now, here's the one I got for you. I was called in by the administrator, a lady that, go figure, and she says to me, Dr. Ure, what are we going to do? You're taking all these patients off of statin drugs. If they have a heart attack or stroke and sue us, what are we going to do? And I said, well, if I know how much damage that these medicines are doing for the patients, and yet I don't tell them about it or continue to put them on it, they can sue me for doing that. So I stuck to my guns, and basically they ended up firing me. So that's the good one I was going to tell you.
That
And
actually,
if you think doctors have it, go ahead.
I was just going to say that actually brings me to the next point, the next question I was going to ask, which is, I mean, we can obviously tell, it sounds like you care a lot more about people than just the money aspect of it, and unfortunately that's something that changed. And I got that even from talking to you before the podcast, when we were discussing things before the podcast started, and just the corruption, the money issues, all this. Oh, go ahead.
Okay. You're right. And there's two things I want to point out. The second one is going to deal with a hurt arm, but the first one, let's look at this COVID thing, for example. If a person went in and they had COVID for whatever reason, and they treated it as a pneumonia, the hospital was able to charge $13,000. But if they put the person on a ventilator, they could go up to $39,000. So everybody got placed on ventilators inappropriately, and it killed a lot of people. And so we need to talk about that. But
I've heard this a lot. Actually, I almost kind of want to stick on that a little bit more, because I heard a lot about, and this is just super general, that hospitals were able to make more money diagnosing something and going a weird, almost back alley way about diagnosing it, it seem.
Before we go into this, can we just call it convid? Do not just call it convid just for the algorithm purpose.
Oh, because we get demonetized. Yeah,
well, no, not even that. Just call it convid. I'm just saying.
Or the pandemic, something.
Yeah, the pandemic. I forgot about this because we actually get flagged on YouTube for this. I completely forgot about that. So we need to limit our language a little bit. I forgot about that.
All right, well, we'll modify that, and I've seen that. And by the way, one thing I want to say right now, I really am enjoying a fellow by the name of Vernon Coleman. Vernon Coleman called himself the little old man in the chair, and I've watched so many of his videos. He's from the UK. He's a retired family practice doc, and he's really right on. So, you guys check it out. But let me tell you about a person that had a hurt arm down at Osceola, which was the Sac Osage Hospital. This goes to show you something else. We're still paying taxes on that hospital here in our county, and the hospital was destroyed. It was bought by the hospital down at Bolivar, and they came in there and they leveled it. We're talking about a hospital that had an ER, that had all of the x-ray stuff, had physical therapy, had patient treatment areas, everything, full-fledged running hospital for the community. Now, in case you guys didn't know, the original plan was to be able to head any direction, north, south, east, and west, and be to a hospital within 30 miles. Did you know that? There was supposed to be a
that makes sense.
hospital
In America?
Yeah. That's great. No,
Yeah.
that's a great thing.
So anyway,
That's a great thing.
okay, well, here's the deal. So I'm seeing a man, he has an injury on his wrist. Now let me explain something to you. Okay, I didn't have to do x-rays because of my expertise in looking at ankles and wrists and so on. I could pretty much tell what was going on, whether they needed a splint, whether they needed a cast, whether they needed the orthopedic doctor, but x-rays were required. Okay, but now something I had to learn on my own, think about this. I would x-ray anybody that fell and had an ankle or a wrist injury to prove that it was not broken. And if I didn't have that proof that it was not broken, and they go out a few days later and slip and fall again, then they're going to come in and say, well, Dr. Ure didn't x-ray it and it was broken, but they don't tell you they fell again. You see what I'm getting at? Okay. Now, this one particular patient, I saw him. It was an arm injury and so on, and it wasn't impressive. He was tender and such as that. And I said, do you have any insurance? He said, well, no, I don't. I said, well, guess what? I can x-ray this. And that's one day, actually, I broke my own little rule. I said, well, if you're not having any insurance, it would cost you another $150 or $200. The treatment's going to be exactly the same. We're going to put you in a splint. We're going to put you in a sling. Treat it as though you have a crack there, and it's going to do just fine. He said, I can't believe it. You're the only doctor that's ever thought about my financial situation and consulted with me to try to help me with my own medical care. And so I thought that was pretty cool.
That's the exact point that I was getting at too earlier when I was about to ask you the question, which is the fact that everything seems to be about money these days and not about the well-being of the patient. And to prove that is the story that I was originally going to ask you about that you told us about ahead of time, that if you're willing to talk about it at all, that would be amazing. Something that happened to you recently, which is why you're not practicing right now. If you could go into that at all, that would be great.
Well, what I'm doing is I'm basically shifting gears. Okay, I'm a Christian doctor, and my wife died 16 years ago. Lovely gal. I don't think I'll ever find one to basically compare to her. But on her tombstone is Romans 8:28, and that says, "All things work together for the good of them that love God," and that's then a period, and it says, "To them called according to his purpose." Okay? So my prayers on a daily basis is for God to guide and direct me in the way he wants me to go, and that's how it's going to be. Okay? But anyhow, there was somewhat of a perfect storm that developed. I don't know, it gets a little bit lengthy, but I had actually 3 complaints come up for the Board of Healing Arts at one time. One of them was from I'm not going to use her name, but let's just say that she was very low on the socioeconomic scale, and I dismissed her from the practice, and she sent in a complaint stating that I had touched her vagina and that I had asked her for sex, and since she turned me down, I dismissed her from the practice. And so she sent that down there, caused a lot of trouble. Okay, all of the stuff she said was a bunch of lies, but it still went there. The other situation that came in was this. I had a patient up in Clinton, and on that particular patient, I was a little bit leery of taking her into the practice in the first place. As a matter of fact, I realized that pain, both acute and chronic, are not being appropriately treated. The doctors are running scared. There's no such thing as an opioid epidemic, a war on opioids, and so on. Opioids are fantastic medicines that work very well. The problem of it is that people are doing things with it they ought not be. They are using it for recreational purposes. They want to get high, and then they also want to go and get the medication and then sell it. For example, an oxycodone, 30 milligrams, like worth $30 on the street. So if you got 60 of those, multiply 30 times 60, look how much money that is for somebody that doesn't have an income. So that causes a lot of problems. Anyhow, I called the chief of police at Clinton. I called an attorney up there. They vouched for this particular lady. I took her in the practice on probation. I actually paid an investigator to do background checks on all my patients before I took them into the practice, because I didn't want somebody that's been making methamphetamines and this and that and the other. So what ended up happening is she marched to the beat of a different drum. She was very intelligent, but yet she was different, and she didn't get along very well with the pharmaceutical with the pharmacists and stuff in Clinton. And so she went up to Kansas City to get one of her prescriptions filled, and they ended up calling me and asking me if in fact the prescription I'd given her was valid. Well, what ended up happening is the pharmacist thought I was doing something inappropriately, and so they sent out somebody to investigate me. And when they found out that I didn't have a sign in front of my clinic, and it looked like it was a bogus organization, they turned me into the Board of Healing Arts. And everything was perfectly fine if they'd have just called me on the phone and said, "What's going on here? We sent somebody out, but here's what's happening." So that was that. And then the next thing is the Dave Lovewell situation. And the Dave Lovewell situation, I can give you somewhat of a thumbnail sketch. If I'm going into too much detail, guide me off, slow me down, ask me for more detail, but I'll try to hit the high points. Dave was a very good friend of mine. The reason I say was is he was basically murdered. He was murdered by the system. He was murdered by a hospice. He was murdered by a nurse that gave him morphine in an overdose by a doctor that ordered it at a nursing home that's had so many sanctions up in Harrisonville. I think it's Golden Years or Golden Acres or something like that. But anyhow, Dave was my very good friend. I saw him on almost a daily basis. And he ended up, without going into a lot of detail, he loved to go out and work with his chainsaw and cut down trees on his property, which is just a short distance from where I live. One day the wind was blowing, and he went to cut the tree with the chainsaw so it fell in a certain direction, so the wind blew it. The wind changed direction, so we went around and cut it the other way, and in between the wind shifting around, the tree went ahead and fell and caught him across the back of his shoulders and kind of pushed him to the ground. With that, if you can imagine taking your toes and of your right foot and just pushing them up to the point where they tear at all the attachment points of your foot. That's what happened to him. And so with that, he had bad circulation, he had infection in there, and another lady treated him for a couple of weeks at his home with conservative medicine. One day he was sitting out here on my driveway. I was piddling around. I looked at his foot. It was just beet red, swollen. It looked awful. I said, Dave, it looks to me like you are losing this battle on what's going on. You need to get into the hospital, get some IV antibiotics. And he said, well, would you put me in the hospital? Would you take care of me? I said, yeah, but the hospital where I work is 4 hours way up in northern Missouri. He said, I don't care. I only trust you. I said, okay. And that was a Sunday. I said, you want to drive up with me or you want to take yourself? No, I'll drive up. So he drove himself up there. I put him in the hospital. For about a week, he was doing better. We got a surgical consult, ended up getting an ultrasound and found out he had very poor circulation of his lower leg beneath the knee on the right. The left was okay. So we wanted to get what's called a femoral artery bypass in the popliteal region to try to get blood down to his lower leg so that he wouldn't lose his leg, okay? So I ended up sending him down to Boone Hospital by ambulance. He was down there for about a week. He ended up calling me. They decided they were going to cut off his leg and they were going to do open heart surgery and do bypass grafts and such as that. And it was more than he really wanted to have done. So I was up at Unionville. He called me to come get him. Board of Healing Arts stated that I convinced him to leave and so on. They just threw a lot of lies against me, didn't want to listen to anything. I went and got him, picked him up. On the way back up to Unionville, we stopped by Kirksville. He saw one of the steakhouses up there. His fourth digit of his right foot was black. Looked like a raisin, shriveled up, black, had to come off. The doctor said, bring him back tomorrow night. I'll take it off in the clinic, which I did. Okay. I kept Dave with me for like the next week. And he was getting better, but yet he still wasn't out of the woods. And he was sitting on the front porch of my deck, a building next to this one that I'm currently sitting in. And it was a bright sunny day, clouds, sunshine. And he looked down at his foot, the fifth digit. Now remember, he got the fourth one taken off in the clinic a week earlier. Now the fifth one is turned completely black. Necrotic, black, dead tissue. Looked like a mummy. And he said, it looks like that one's got to come off too, doesn't it? I said, yeah, it does. I said, where do you want me to take you? I said, you want me to take you back up to Kirksville? No. Do you want me to take you up here to Clinton let them deal? No. He said, can't you just do it right here, right now? Okay.
That's a good old country boy, by the way. That's some good old country boy stuff right there. No, just get it done now. I'll take a sip of Jim Beam. Just go on ahead and chop it off now. I like it. I like it, by the way.
Okay. Well, you'll appreciate this. When I was in the Army, I went in, I was a conscientious objector, and I was trained as a combat medic, okay? And so I was trained on how to take care of battlefield injuries. I know how to take care of things along the roadside. I've saved many people's lives out in the community and like that, that would have died had I not intervened and done what I did. Now, they said that it was unsterile. They said it was on the back porch. If you look it up, a gal called me. I've got it back here. It's not important. Somebody from Associated Press. She said, "Will you talk to me and tell me what happened?" Yeah, I talked to her, told her what happened. I said, "Well, I would like you to say the truth." Well, that thing apparently went viral. It went to the UK, whatever. I haven't even read it. I'm not going to read it because it's nothing but a pack of lies. She said, "It looks like you cut the toe off on the back porch." I said, "No, actually, it was on the front porch." So there's another lie that they put to it. Anyhow, so I have preps here. I've got sterile instruments. I've got sterile drapes. I've got sterile gloves. I've got betadine that you'd use in the emergency room. I've got suture material. Everything was done perfectly fine. And, local anesthetic injection. He had no problems whatsoever, and his toe was taken off without any deal. They made a gigantic deal about it. That's the major reason they decided to take away my license. So it's like,
and they
okay,
only found out about this scenario. Why?
Unfortunately, somebody, I think they asked me if I had amputated his toe. What do you do at that point? You gonna lie? No, I did amputate the toe. Well, where'd you do it? Well, on my front deck. It starts getting worse, and like that. But it really was perfectly fine. I'm not even going to say the things that I've done with other people in places and all like that because I don't need any more flack.
Yeah, don't. Yeah, this is the internet. Don't do it.
And I have some non-medical doctor in my family from Illinois that, man, if somebody had a toothache on my mom's side, they would just drink a bottle of whiskey and, man, you hit me as hard as you can right here in the side of my jaw and we'll pop this tooth out. And that's how they did shit. Like that's old school, man. That's old school. And if somebody's trusting, man, there's.
All right. Well, now let's get to the end of this thing. I think I can do it within maybe 2 or 3 minutes. I'm hitting the high points. So anyway, I paid for Dave to be in a motel up at Unionville. I paid for a lady to be a nurse. She wasn't a nurse, but to take care of him and stay with him. I took food to him from the hospital. He was up there with me for 3 days. And on Tuesday night, the lady calls me that was with him and said, "Dave said he's wanting to pee on the door of the motel." I said, "Yeah, something doesn't sound right. We're going to have to check this out, see what's going on." So I put him in the back of my van, which had a bed back in there, took him back over to the ER. The doctor that was on duty there was the chief of staff. She says, "Well, let's not admit him here. He needs to go to a higher level of care. We can put him in an ambulance and send him somewhere." I said, "Well, that doesn't make sense. I can drive him to wherever it is we need to take him." So I took him. I should have never taken him to Research Hospital in Kansas City. Research Hospital basically is complicit in having killed my friend. And the reason why is because he was in there for about a week, maybe 10 days. I put him in there. I was with him in the emergency room. In his room, the chaplain of Research Hospital came, and there were 2 nurses that witnessed that Dr. Ure, his physician, was supposed to be his medical power of attorney, so that any medical things need to be done on him, I was the one that would say yes or no on his care. And he asked me to do that. And one of our friends, a retired attorney, she was like the secondary back, okay? So anyway, Dave did not want to have his leg cut off. Finally, it was decided he needed to have an amputation. I talked with the surgeon up at Research. He said he was going to take and cut off his knee, below the knee amputation. It was all scheduled. I called from my office here to talk to them up at Research. Dave was in the holding getting ready to go into surgery. I talked to a nurse to find out what was going on, and you know what she said? "I can't talk to you because of HIPAA regulations." HIPAA regulations. I'm his doctor. I put him in the hospital, but yet she's not going to be able to give me any information about my own patient? absolutely absurd.
Or you-
And she also said that she, excuse me.
No, I'm sorry.
Go
You
ahead.
said you had power of attorney too, like even power of attorney, or was that on a different level? Did I mishear you on that?
No, it's called medical power of attorney.
Oh, okay. So that's
So
something
that,
different.
you
Okay.
know,
Okay.
Yeah, it's full power of attorney. So anyway, and then they said that the attorneys for the hospital had advised them not to talk to me. So I just backed off of it and thought, okay, fine, you know, get his leg cut off. I didn't even call up there for the next week thinking everything was done. And then I have a very good friend named Kevin Phillips, and I went in there to see Dave on a Wednesday night. His foot was swollen. I've got pictures of it. I tried to show them those pictures at the Board of Healing Arts. The attorneys and the board, they wouldn't even look at the pictures of what was going on. They have no idea. They wanted to get rid of me. You know, they want to shut the whole thing up. They don't care that Dave was murdered. So anyway, I'm on my way to Research Hospital when I find out that they weren't going to do the surgery. Okay, and then he calls me and says, because he was in the room with him, that they've decided to take him to the nursing home down in Harrisonville. So I was between Harrisonville and Kansas City on a Friday afternoon, turned around and was at the nursing home when the ambulance arrived. And I told him I was his doctor. In the meantime, his family had gone down to Osceola, gotten rid of me for medical power, and had one of the brothers to be his guardian. Okay? And so I wanted to take him, put him in my car, take him on up to Kirksville, have him have the surgery. If he had done that, he would have been alive today to be sitting here talking with us, and everything would have been fine. They would not give him to me from the ambulance, even though I pleaded with him, and he told them he wanted to go with me. They then put him in what they said on the ambulance was, we have to put him in the hospital. Well, when you read all the paperwork there, it states very clearly that the doctor that's in charge of the patient has the right to tell any EMT, paramedics, or whatever, what you want to have done with your patient. So I think actually there's a liability with the Kansas City Fire Department, and the ambulance for not listening to me. Anyway, they went ahead and put him in there. So I went in and talked with Dave, trying to prove by video that he knew where he was, that he wanted to get his leg cut off and so on. And that's where the video that I put on, it's the first thing I ever put on YouTube. It was seen by people. They took it down within about 2 hours. I still have copies of it. You know, Dave is pleading for me to take him out of there. He wants to go and have the surgery. 3 squad cars showed up, 15 police officers. They said they were going to arrest me if I didn't leave because I was on private property. The administrator of the nursing home filed a complaint with the Board of Healing Arts against me, who's in there fighting to save his patient and his friend. And then the lady that's in there walks up to his bed and says, I'm such and such and so. I'm from hospice, and we're going to take good care of you. I said, yeah, Dave, what they want to do is they want to kill you. That's what they plan on doing. Okay, she said, oh, no, we're not going to do it. We're just going to take good care of him. Well, that was Friday. And by Sunday night, Dave was dead. And I talked with the coroner. I actually called the Attorney General of the state of Missouri. I called the sheriff. I called everybody I could possibly think of. Nothing I could do would change anything at all. Dave is dead, and I wished I had done something different, but I don't know what I could have done.
That's aggressive. Why would hospice be taking care of him? At that point, aren't they basically saying that he only has a short period of time to live?
Well, yes, that's exactly right. When hospice is brought in, usually that is a terminal situation to try to take care of pain and so on. But it is common knowledge that morphine knocks out the respiratory drive, and doctors have basically helped people to ease on through the death process.
But if amputating his leg was initially the first plan, then why did they go away from it and not end up doing it? Is it something he didn't want to do? And then they wanted to do it, but then they're like, no, we're going to take you to this nursing home, and then you're his doctor. and then you're like, no, you should definitely get your leg amputated. So 2 people are saying here that you need to get your leg amputated, but then he goes to hospice. I'm just confused.
Well, you're confused. I'm confused. That's what I say. Dave was essentially murdered. Just as sure as I'm sitting here, and I wish there was some way that we could prosecute the nursing home, the doctor, the nurse that gave him the medication. I would like to go against Research Hospital. And I would, anybody that's looking at this, if you think you'd like to go to Research Hospital and go into their ER, I strongly urge you to reconsider and go to a different facility. Matter of fact, I'm going to tell you something right now you might not have known. You know what the third cause of death in the United States is?
Is it medical malpractice?
Death by doctor. Death, not necessarily malpractice, but taking medication. Because medication that everybody is taking are synthetic, made by Big Pharma. And it's not curing anything. It's only taking care of the symptoms. Let's give somebody a blood pressure pill. How come we're not getting their weight down? How come we're not helping them, control their diet, show them an exercise program? All of it can be done without having to use it. And whenever you see these things on television, I can't even pronounce the various things that they're marketing on the commercials on general television. And then they say, and this may cause death.
Yeah, no, that's usually in the side effects. Really the side effects are like, oh, this may cause death, suicidal thoughts, anal leakage, like just all kinds of stuff.
Which is the worst kind of leakage, by the way. The worst kind of leakage.
Well, yeah, that is the one which was the one that was used to keep from absorbing fats. And anal leakage was basically to be expected in taking that medication, but they're not side effects. They are the effects that people have.
But I mean, to be honest, that fits really well in with just the general public, because people just don't want to work for anything or change a lifestyle. They just want to put a small, tiny cylinder into their mouth and then call it good for the health.
Now, I will tell you guys. I'll tell you guys this, and we can talk about it sometime. I'm sure it would be interesting to you. I am right now studying feverishly essential oils. Now, I don't know if you've looked at them very much, but I had an epiphany when I was in Cairo, Egypt, in 2010. I was riding along in a cart with my girlfriend. We were being pulled by a horse. It was a really neat thing. We'd been into a perfumery. I'd seen frankincense, I'd seen myrrh, all of these various plant materials, magnolia drinks, and what have you. And the epiphany I had is that we humans are affected by light, color, sound, what we eat, the different kinds of foods, needing fresh air, needing good, clean water. All of these things interact and are terribly important to us. And I'm going to ask you guys right now, here's a question for the 3 of you. Let's see how you get it. What were the 3 gifts that the wise men brought to Jesus?
You already named 2 of them. It's myrrh, frankincense, and I should know this.
I was like, you should know this better than us.
I know. Oh, I sound really stupid right now. I should know this.
Murder? No, that's
it's myrrh, frankincense, and gold, right? The other one was gold. Was it gold?
You got that, but here's the thing. Because gold, I've asked a lot of people that, and interestingly, almost everybody forgets the gold. Tons of people I've asked, and they'll typically get frankincense or myrrh, and get those. They might say myrrh and frankincense, but the Bible, I think, says gold, frankincense, and myrrh. And the frankincense is essential oil, and the myrrh is essential oil. And the frankincense, I have a mister that's absolutely awesome. It changes colors. You put the frankincense in there, and it helps you, in meditation, calms you down, the aromas of it, and and I've got a book I'm reading now that are called Essential Oils of the Bible, and it talks about how the essential oils have healing ability. That once you use them to heal whatever it is you're trying to take care of, you don't even need the essential oils anymore. Okay, but that's different. Also, one thing I want to point out to you guys that's really important that a lot of people may or may not know. I'm a DO. DO stands for Doctor of Osteopathy or Osteopathic Medicine. Okay, Andrew Taylor Still was an MD that started the first college of osteopathic medicine up in Kirksville. That's a medical school that's running up there now.
What is
Okay?
that? Is that bones?
Well, the osteo deals with bone, but an orthopedic surgeon is the one who does the specialist to deal with bones, and he can be either an MD or a DO. Okay, now allopathic physicians typically will treat symptoms. Osteopathic physicians hopefully will find out what's the cause of the problem, try to treat that, and try instead of just treating the symptoms. Now, there's another thing I think you'll find very interesting. The chiropractic profession came out of the osteopathic profession. A guy by the name of Palmer went up there to the Kirksville school. I don't think he ever enrolled to be, a medical student, but once he saw the manipulation and such as that the chiropractors do, he went back east and started the Palmer School of Chiropractic Medicine. So that's another little history for you.
So, man, there's been a lot of good things in this podcast.
Yeah,
man.
I know.
Doctor Ure, I mean, amazing stuff, man. I kind of want to switch gears a little bit. And we were on the phone yesterday when I was at work. We talked a little bit on your thoughts about marijuana. What can you tell us about the effective use of marijuana in the medical arena?
Okay, that's a good question, and I've looked a lot, I've studied it a lot. I can tell you, I have never smoked any marijuana, and I'm not president of the United States. I never inhaled. But
Well, you can take
okay,
edibles now, man. You don't even have to inhale. You can just ingest.
okay, here. All right, there are an untold number of chemicals in marijuana. Okay, and I was watching an interesting show that dealt with John Belushi out in Oregon. Has apparently got a brand Belushi marijuana, and he was down in South America trying to get some seeds and stuff to grow this stuff out there and all. And so I guess Illinois, from what I can see, has decided to have unrestricted. But here's the deal. The CBD oil is cannabidiol. That's supposed to be the medicinal part of the marijuana, okay? And it can be taken internally, or it could actually be used topically. And I'll tell you what, I have used some CBD that's been manufactured by a friend of mine, and I can attest to the fact that it takes care of pain quite readily. It also can give you a little bit of somnolence, but you certainly don't get any psychotropic effects whatsoever. But now I'm cautioning everybody hearing this, do not go and buy CBD oil from the video store, smoke shop, or anything like that, because it's all synthetic. It's not a plant product. It's something that's been made in the laboratory. And it does not have the effectiveness of the medicine that's made by people that actually distill it, boil the flowers down with alcohol. And I took a course, matter of fact, interestingly, Dave Lovewell took it with me several years ago. It was called Using Wildflowers for Medical Care. In other words, using the plants. Give you a good example, walnut trees. If you use the green hulls of a walnut that we have growing around here, put them in alcohol, shake it up 3 times a day for a couple of weeks. You've made your, and then pour off the liquid. You've made your own natural antibiotic. And so there's a lot of things that we can do along that line, and I've invested a lot of money and spending a lot of time studying those things. But back on the marijuana.
But isn't
Okay.
even like garlic? So like real quick, even like garlic, isn't that like nature's natural antibiotic? Like I grew up with a very
And onions, I think.
like
Yeah.
even like I grew up in a really natural family because my grandfather actually owned a health food store out in Illinois, and he talked about the healing properties of even garlic, and he believed in everything natural.
Well, absolutely, and the Bible says, if you're a Bible believer, that God gave us all of the plants to be used for the benefit of ourselves. And here's something that's pretty interesting. In our central nervous system, we have what are referred to as cannabinoid receptors. We also have nicotinic receptors. Well, you know, if we have those receptors, does that mean that God expected us to smoke tobacco and smoke cannabis? It might seem so, but one thing I will tell you, as far as cigarettes go, there's no tobacco in cigarettes, okay? It's nothing but chemicals that they come up with to make it highly addicting, and it's like smoking sawdust, okay? So, you know, I've never smoked, I've never lit a cigarette, you know, you would think that they would want a doctor such as myself that saved lots of people's lives over my career, which we could talk about that sometime, some of the major saves and like that. But I've never inappropriately touched a patient. I've never had alcohol. I've never tried to get sexual favors from a patient. I've never sold, you know, medicine to somebody for money to get rich with it. I'm trying to think about, I've never misbilled Medicaid, Medicare, any of those type of things, but I cut off somebody's toe.
Your friend, one of your best friends, man. If I was a doctor, and I
Who
knew,
requests? I was gonna say
like,
requested.
dude, if I knew what you knew, doctor, and Jesse's toe was about to fucking fall off, and Jesse is in the basement of my house, and he's like, "Paul, cut my fucking toe off right now."
Just to be like, give me a shot of Jim Beam and let's do
I
this.
would cut your fucking toe off.
I
man.
have a really good example of this, actually. Me personally, I've had a tiny cyst on my arm. I'm 90% sure it's like an ingrown hair or something, but it's a cyst on my arm. And I don't have the balls to do it myself, but I would love either my girlfriend or one of my boys to videotape it. Just get an X-Acto knife, sterilize that, like do it for me. Just do it. I can't do it myself, and I'm not going to a dermatologist and paying $500 for them to do it. I'm like, just do it. Just get the cyst off my arm. Make sure the sac, I've seen YouTube videos on it. Make sure the sac comes out of it too, that way it doesn't come back. I'm like, we'll make a podcast out of it. I'm going to get Johnny to do it on the podcast.
I can't do that, bro.
Nobody wants to do it. Nobody wants to do it.
No,
Johnny might lose his medical license, man. You be
Yeah.
careful.
See? He already...
Okay. Now here's where you got to think about that, okay? Because as soon as if you do it yourself, that's no problem. But as soon as you have somebody else do it, they can come and arrest them and bring charges of you're practicing medicine without a license, and now we're going to run you through court and so on. They brought felony charges against me for a paper error. For a paper error, for a mistake, for not having a certificate on the wall. They said I was a distributor of narcotics. And they sensationalized it. KY
Pablo
Green,
Escobar.
Springfield.
Pablo
Oh
Escobar
my
in
God.
Scrubs, right?
You would think. But I'm not. Hey, listen, I want to get back to the marijuana. Okay? I'm firmly convinced that a person that's smoking cannabis should not be flying a plane or driving a car.
Are you really someone to
Because I
tell us
agree.
about flying a plane, though? I've heard what's happening.
Wait a minute, what did he say?
I said, can you give advice on planes, though? I've heard what happened to you. Just
We've
joking.
heard your story. We're just cracking jokes, man. We're shooting
Yeah,
you
well,
some...
you go fly. As a matter of fact, I'm making a runway up on my property. Like my good friend, matter of fact, Kevin, the one that did the video that I told you, he's working with some dirt moving equipment, and we've got a wonderful dirt runway. It's going to be grass that we're putting in up there, and we'll be taking off and landing on it. But you know, the problem of it is when you've got a pothead, you know. Now, let me say this: do you realize who the two presidents are that really caused problems with marijuana? Do you know who they are?
Nixon is the first one that comes to mind.
That's right. Nixon was one.
Who's the
Who
next
was number
one?
two?
I couldn't tell you all of them.
Clinton.
Since oh, Clinton. Clinton was even.
No, Bill Clinton. And have you ever heard of the movie called Reefer Madness?
Yeah,
Mhm.
absolutely,
Mhm.
Okay,
absolutely.
Reefer. Yeah, you can look at that movie, and it shows a lady that smoked marijuana. She goes running down the hall, jumps out a window, and kills herself. Well, I can guarantee you that's not what people do that are smoking marijuana.
No, that's
I can't
PCP.
even.
Well, that's PCP, by the way.
I was gonna say I
People
can't even
do
run
do
that
that on
fast when I
PCP.
smoke. There's no way I'm running out a window. I just want to sit on the couch.
Yeah. So anyhow, marijuana. Oh, by the way, there is a synthetic marijuana called Marinol, and its use is to help a person to develop an appetite, and it's also used for some weight loss. But everybody thinks write me a prescription for the marijuana pill and it'll get me high. Well, it doesn't work that way. But anyhow,
Did they just try to synthesize the appetite stimulant from marijuana? Because that was the biggest thing with my grandmother whenever she was going through chemotherapy for like 6 years, and basically died from chemotherapy and not being able to hold down food. And I was like, man, if she was just able to eat, she would have probably been able to pull through and actually live.
Okay.
But
your grandmother, I don't know what kind of cancer she had or whatever, but chemotherapy is what's really killing these people, causing neuropathies and things of that nature. There are other things to be done. There's a guy by the name of Brzezinski, Dr. Brzezinski, that's down in Texas. He's curing people of incurable brain cancers. He has something called the neuroleptons that he's developed. I don't know a great deal about it. I just simply read about it. But if it's a universally fatal brain cancer, and he's got curing of 1 out of 3 people, that's a 33% chance. Wouldn't one of you guys want to go there if you knew you were going to
for
die?
sure.
Or maybe
absolutely.
Thir-
Especially if everywhere else is
And
less than
well-
1%, which is probably what it is.
Well, okay, and that's right. And the state of Texas has been after that man for 10 years, costing him hundreds of thousands of dollars. I don't know if he's still in practice, whether he's got a license. But now listen to this one. This is very important. There's a guy called Simon Cini, Simoncini. Okay? He is an Italian doctor. His license has been taken away from him in Italy. Okay? And he came to the conclusion that the soft tissue tumors looked very much like fungal growth. And he found that the cancers like to live in an acidic environment. So he started treating them with sodium bicarb, plain old baking soda. And you can read more about it, but he had a fella that had lung cancer, a rather sizable tumor, and was given a very short period of time to live. So he went to Simon Cini. Simon Cini passed a tube down by bronchoscopy down into the lung, right to the tumor site, bathed it with a sodium bicarb solution, cured the guy. He's alive 20 years later and still living. So, would you do that, or would you die of the lung cancer?
Would do that.
Yeah, you do that. But there's no money. There's no money in curing people that
There's
quickly. That's the problem.
All the
right?
money's in treatment, right? We covered that earlier with medicine, why they just treat stuff instead of curing it.
Now what you guys just said is really terribly important. If there's no money for the pharmaceutical companies because they can't patent it, they can't patent earthing, for example, like we'll talk about it another time. They want the revolving door. They want the patient coming back for more medicine, for more treatment to keep them in that until they die. Now, what about our nursing home patients? They're warehousing the old people. They're keeping them alive for money. The families just dump them and get rid of them and most of them don't ever go and see them. And those people are so lonely, and they're so sad, and they get such horrible care. And I'll tell you something interesting. I used to be, back when I was a full-fledged doctor, up in the Olathe area at Del Mar Gardens. I was a co-director, medical director of the nursing home, right? And there was another little older gentleman, and we had to go to meetings once a month. And we're sitting there waiting for the meeting to start. And he was talking about the nursing staff at the nursing home, and he made this phrase. He said, what we're dealing with here is the cream of the crap. The cream of the crap. The nurses that don't quite have the ability to work in the hospitals and such as that go to the nursing homes.
That's awful.
That's sad, man. That America has came down to that because unfortunately in other countries the culture is like, hey man, you take care of your parents whenever it's their time. And the diets that we have, the food that we consume, you and I have talked about chemtrails. We don't have to get into that in any way, shape, or form. Take a shot. First time. But the effects that all the GMOs and these chemtrails have on our bodies are leading us into these nursing homes to where you have people who are CNAs taking care of you who aren't really able to take care of you. It's sad. You're right. Very sad.
What's really I'm sorry.
One thing. Go ahead. All I was going to say here is, I might have been a little bit too harsh, but LPNs, RNs, but then when you've got the CNAs, those are the people that really care about the patients, that rub their back, wash their feet, change their bedpans and stuff like that. The other higher level nurses don't mess with patients.
And I know what I'm about to say comes back to like big pharma, but if you have somebody, a gas station, selling cases of water for $20, $30 for a case of water, that's money gouging, and they get in trouble for that. But then you have big pharma come in and try to, if you don't have insurance, it's going to be $600 for an EpiPen, and telling me that isn't the same thing, taking advantage, that's money gouging. That's money gouging to me.
All right, you brought something up. Here's a good story for you. A very good friend of mine, Kevin Kelgard, came to me about a year ago on a Saturday morning. He said, I need to talk to you about a medical situation. I'm going to have to be careful on here of not giving a great deal of medical information about him because I don't want to be, charged with HIPAA violations of somebody's medical stuff and like that. But leave it to be say that he ended up having something that was absolutely, devastating. When I called the lab and like that, they hadn't made it very clear to him at all really what was going on. We were able to get it all ironed out and like that. But here's the deal. The medication to keep him alive ended up being $130,000 a year. $13,000 a month. $13,000 a month. Can you believe that?
No,
that's just you're not even living at that point though. You're just living your whole life in debt after that, and like, I don't know.
Doctor, we're a little bit over the hour mark, man, and I don't. If you guys want to continue, that's fine. But
I would like to save some more for the next time.
No, I would too.
That we have the pleasure of having.
Because this is my thought process, or our thought process for Talk Junkies is if we go like 2 hours or a little bit over, people will lose interest after a little bit. You know what I'm saying?
Understand?
It's like a Lord of the Rings movie, man. It's hard to watch this long.
And I really think that you guys are a dynamic trio here. I'm very proud of what you're doing. And you told me before we went into the recording session that you didn't have the abilities for people to call into you. Very easy to get that done and start getting a call line in where you can have them ask their question.
We could do it, but like when you start live streaming on YouTube and you say certain things, they'll shut your live stream down mid live stream. You know what I'm saying? So There's pros and cons to doing live stream. If we had our own website and we were live streaming, we'd be completely okay with that. But we're specifically on YouTube, so I think what's best for us right now.
Man, you're dreaming where we're dreaming. We would love that subscriber base and have that amount of people to be able to do that. One day we will.
It's the direction we will go eventually. It's just
we
not
have
in
to
our
build,
wheelhouse at the moment.
You got to start somewhere. So we're working up to that.
Okay, well, we have tons of things to talk about. I have many varied interests. Next time we talk, I want you to remember to ask me, when did you really wake up, or did the light bulb come on for you to realize just what's going on behind the scenes? And we can talk about.
No, if you're willing
man.
to come back on, we'd love to have you back on, because I mean, I'm speaking for all three of us here, but I assume that we're all three in agreement. We'd love to have you back on. Man, your stories are super interesting, actually. Everything from the plane to the unfortunate loss of your license there with the amputation and all this different. No, it's super interesting, and I love it. That's why we do this podcast, is to have conversations with people
and meet interesting people like you. And we would love to have you back on.
Well, you holler at me when you want me again. And it's been my privilege, and I'm glad I got a chance to meet you. Maybe sometime, since you're not very far from me, I'll come up and sit in your studio, and we'll be there live together.
There we go.
I'd be fine with that. I'd be fine with that.
100%, man. Well, Dr. Ure, where can we find you one more time? You have a website. Is there any other way that we can contact you? I know you don't have your practice right now, but you are doing consultation. How can people get involved in that?
Okay. Well, the consultations that I'm doing now, I've decided to do alternative medicine, and I'm special emphasis on treatment of autistic kids. I know that I can help the parents of autistic children realize ways to improve the level of achievement of their children. And also, I was trained as a lab technician in the Army, and I'm doing evaluation of abdominal parasites. I know people don't really like the fact of sending me a stool specimen. They think that's all ucky and icky, but doctors and lab techs and all, that's just part of the program. And then the other thing I'm really working hard on is the treatment to help people that are super sensitive to the electromagnetic spectrum. And if you go to News with Views, just 3 words, News with Views, and click on my name and go down, you can read all the articles that I've written, COVID articles and so on. And the other thing that you might be interested to look at is I have a website called Truman Lake Wilderness Adventure.com. Simple, Truman Lake Wilderness Adventure.com. And then my own website is downtoearthmedicine.org. And I had a fella call me he emailed me from Osaka, Japan, complimenting me on one of my writings. So I thought that was kind of fun.
I actually read a little bit on your downtoearthmedicine.org, because Paul sent me the link to it. I read the about section and some of your thoughts, that like the section you had wrote on COVID, blah, 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 whatever that word, I can't say on here, but the pandemic and all that stuff.
I hear you.
So,
right,
I read
thank
into
you,
that.
guys.
It's super interesting.
You know how to get a hold of me, and I'll holler at you guys if I come up with something I think you should be aware of.
Well, thank you. Appreciate it.
Thank
And
you,
man,
Doctor.
if you do any fishing out by that lake, you're more than willing to invite me.
Dude,
So I'll come
Truman-
and fish.
Truman-
I'll come and fish with you.
Truman
man.
is
If
my
you
favorite
fish,
lake to fish on, man.
I'll fish
Truman.
with you, man. You invite me any day. I'll be out there with you.
You guys are only up there at Belton. The boat ramp comes right up into my driveway. I have john boats, sailboats, canoes, wave runners, pontoon boats, power boats. You name it. we got
No,
it.
I just want to fish, man. I'll do bank fishing, whatever you want to do. I just want to hang out and fish with you, man. That sounds like a good time. If ever you want to do it, let me know.
Come on down. That'll be fun. I'm looking forward to it.
Yeah.
All right, well, Doctor, thank you for joining Talk Junkies, man. We'll holler at you soon, and we hope to see you on again the show soon.
Have a great night.
All right. Thank you for your time, gentlemen.
Thank you. Well, there you have it, ladies and gentlemen. The cameras actually went out. I'm not entirely
Again?
again. I mean, it went throughout the most of the podcast. I don't know. I'll get
That's
it
why we
figured
can
out.
really only do an hour
You
at a
just
time
need
as
to keep
well.
it plugged in. Like if you just keep
No,
it
it
plugged
had
in?
it had a full charge, but we still have audio right now. We can put some cool pictures, maybe of Doctor Ure's website and shit like that up here real quick. I hope you guys like this podcast, man. It's super informative. He had a lot of great, interesting stories, man. He's a doctor, an ER doctor with a lot of great stories. So hopefully, I think you guys enjoyed it. And
Yeah.
Oh, absolutely, absolutely. He was phenomenal. Super interesting guy. I mean, you want to
That
delve
man's
deep
got some.
into
That man's
mind.
got some stories to tell for sure.
yeah, 73 years old. He's lived a life. That's for damn sure.
Yeah.
And the amount of people that he's helped and is going to help, I think that's really cool.
That's the biggest thing that I took away from it. That is, it's nice to meet. Which I'm not saying there's a ton out there that don't care. I'm sure that the majority do care. But it's always nice to run into someone who is in the medical field who doesn't let the money part and the fear take over, and he's still willing to do what it takes to help his patients and his friends and his family, because that's more important at the end of the day.
Yeah, and to be the age that he is and still want to do good for people. You know what I'm saying? Like, he could just retire and go to a beach. I mean, he has his lake house with all these things he just described, and he could just focus on that, but yet he still wants to help people. That's awesome.
This is his passion. No.
Yeah. The biggest thing that you guys can do to support Talk Junkies right now, honestly, is just share this video. Facebook, Instagram.
Dislike it. Tell people
Pornhub.
how much you hate it. Like whatever it is.
Just
somewhere.
share the shit out of this video, man. Even if you or Facebook doesn't
what it takes.
even show anyone, just if 100 people do it, 100 people do it. But sharing the video, liking the video, subscribing to us, to all our junkies out there.
Stay fly and ring the bell.